Throughout today's webinar, we will hear from Cami Norland, CEO of Integrative Resources. I'd like to pass it along to Angie LaFlamme to introduce Cami. Thank you for joining us, Angie, and I will now turn it over to you.
Thank you, Kiona, and welcome everyone to our webinar today. As Kiona mentioned, we have with us today Integrative Resources Chief Executive Officer Cami Norland. Cami is a national and international speaker and facilitator with over 20 years experience in healthcare, specifically rural and mental health. After 12 years of traveling across the U.S., working with state and federal governments, small rural hospitals, rural health clinics and networks, and numerous community-led initiatives, Cami's identified a systematic need to integrate resilience practices into organizational cultures as she's observed too many people compromising their health for a job that could replace them in a week. The need was so strong, Cami founded Integrative Resources, LLC, combining her expertise in strategic planning and community development with her knowledge in education and resilience, positive psychology, and mind and body medicine approaches. An organization or community's greatest asset is the health and resilience of its people. Being intentional about our health and aligning our values with actions simply makes sense with a C. So with that, I'm going to turn it over to Cami. Welcome, Cami. And Cami, if you're speaking, we cannot hear you.
Hello.
Here we can hear you. Hi, Cami. We can.
All right. Yeah, thank you so much, Angie and Kiona, for the fine introduction. It's a delight to visit with some rural health network leaders. I'm a former employee of the National Rural Health Resource Center, and so I'm very familiar with the excellent work that you are doing and that you have been doing in the past. And so it's with that knowledge, I was invited to share my work that I'm doing now with Integrative Resources. Integrative Resources, we work with universities and hospitals and clinics, networks, and communities to help them create healthier, happier places to be. Frankly, what this is all about is helping people name what they're already doing that's working well, reframing challenging scenarios, and then aligning those values to actions and really then operationalizing them. I work with people who recognize that focusing on an organization's greatest asset, which is the physical and mental health of their staff, is a vital economic strategy. And this work has me traveling throughout the U.S. and internationally as well. Thank you for completing the poll here. I just wanted to see where folks were at in terms of their perspective on integrating resiliency practices. And I'm glad to see that work and stress levels will be reduced as a result of listening to this presentation, and perhaps you can learn some tips on how to incorporate that into your own life. Thank you. So I'll share a little bit about, see if we can close that poll. Thank you. So the work that I have been doing, I've been, like I said, I've been traveling throughout the United States and working internationally. This spring I was visiting the Western Sahara, working with the National School of Morocco and local community leaders on the subject of leveraging the resilience of the community to spur economic growth. Just a little bit of background information about this area. This is a community that's been at war for 30 years. It's still a disputed territory at this time. They are currently occupied by the Moroccan military, yet there's no government, there's no taxes, no public health, no clean water, no sanitation, and no health care. The ladies pictured here are from the Female Federation of Entrepreneurs. They're a group of nurses, social workers, doctors, all looking to start up a clinic in the community as well as strong community support systems to improve the health conditions of their friends, their family, and their neighbors. This area that they live in is in one of the most remote and isolated communities on the planet because it's surrounded by a large wall around the community, and they estimate one of the world's largest area of landmines, 7 million landmines on the other side of this wall. So these people who are traditionally nomadic people are in this, behind this wall, and they're trying to figure out how can we build a community and how can we align our culture with the culture of the Moroccans' approach towards capitalism. They must really rely on their ability to adapt, persevere, and be resilient in order to survive. I learned so much from these exemplary women who are really bashing those cultural norms. And I'm grateful that they opened up their doors and their hearts to share in the creation of this plan to integrate resiliency. And I like this picture because you can see a glimpse of their culture. See if you can find which one of them is me in the picture. The song from Which One of These Doesn't Belong in the Picture? It comes to mind when I see this, but I'm only joking. This is, they were so inviting and so warmly welcomed me into the work that they're doing. And I was invited to work with them to help them reframe the situation that they have been going through. They've spent so much time focusing on what's not working well, and they wanted to try and find how can we leverage our values with the values of others in this community so we can work more cohesively, we can work more collaboratively, and improve, ultimately, the health of our community. So this is an example of some of the work that I am doing both stateside and internationally. During this presentation, I'll be sharing with you some of my stories from throughout my career and my journey of resiliency, and I'd love to hear from you about your perspectives as well, because we all have a story to share. So during this conversation, we're going to be recognizing what are those early signs and root causes of distress within yourself, because when we are always stuck in that mindset of identifying what's wrong, that's our brain's natural default mode for survival. If we weren't operating in that mode, we wouldn't be learning. So we want to be able to still maintain that, and that's our default mode, but we also want to be able to retrain and rewire our brains to help find what is working well. What is my purpose? How can I align the purpose of the work that I'm doing with my own personal values? When we can find and be strategic about doing that, we mitigate those opportunities for stressful situations. So we can more effectively do the work that we want to be doing and fulfill the mission of our organizations most effectively. So I'll be sharing with you some strategies on how to do that both on an individual level and on a team level as well. So how can you adapt that process and work collectively when you're all focused on aligning your values, or all focused on identifying your strengths and your existing resiliencies. And then we'll look at how the impact of integrating this process and integrating resiliency in your network can be beneficial for you in the long run. So I'll share with you some stories. I started my career off as a psychotherapist working at an outpatient mental health center. I was the youngest therapist by far. There wasn't much turnover in this clinic, and let me tell you, when I first started there, it was straight out of grad school. I had my cape on, and I was out to change the world. And maybe too much hasn't changed from that, but I was a lot more naive and inexperienced of the work environment that I was going to be heading into and working with the clientele. And let me tell you, it was not easy adjusting to that environment. It was a culture, organizational culture, that was one of us, the providers, versus them, the patients. It seemed like it was a survival tactic to operate in that way. You'd hear and experience the extreme highs and lows in 8, 10, 12 hours a day. Sarcasm was rampant in the culture. In order to fit in and to know that your coworkers had your back because you wanted them to have your back, it was unspoken that you had to bash someone or some policy, and it was a culture of blame. During my time there, we operated a suicide crisis line for the county, and it was my first night on call. Now, the average number of calls in an evening was 3. However, on my first evening on call, I received 27 calls and 1 completed suicide while I was talking with her on the phone. Nothing prepares you for your first death when you're a practitioner. Nothing in school can prepare you for this, for these moments when you hear someone's final words and pleas for help. If some of you out there have experience as a healthcare provider, you know this. And you can, of course, recall your first experience. This impacts us. This changes us. These deaths teach us something. I was so rattled with reality that my expectations of approaching my new career with that cape on my shoulders and being someone's hero set me into a sin of self-reflection. And when I got back to the office the next morning, I got a high five from my boss saying, looks like you earned your stripes last night. And I heard a lot of insensitive comments about this woman from fellow staff, and other staff teased me, stating that, 27 calls, wow. You know, I told my clients to call you because I knew it was your first night on, and I was curious to see how good you were and if you could handle it. It took me by surprise that this was the environment of individuals that I was working with. And I know that this scenario is not uncommon, unfortunately. When you're in that state of survival, in that state of stress, in that state of exhaustion and fatigue as a provider, and you give it your all and you've been doing it for years, now we recognize that I was working with a team of individuals who were very burned out. And it was creating a disservice for themselves and for the individuals that they were working with. If there's a poll, if you could share one clue, action, or attitude that indicates to your coworkers that you're starting to put up your defenses or burnout, what does that look like? You could just type some of those answers, one clue, an action, or attitude. Showing irritation, yes. And impatience is huge, that's correct. Oh, becoming more forgetful. How many times has that happened where we're operating in this default mode and we forget why we walked into the room, and we forget exactly what we were going to do when we got there because our mind is so busy trying to multitask. Absolutely. Oh, and the lack of passion, annoyance, distracted, withdrawal. Thank you. Oh, another really good one, when you start having nightmares about your job. Yes, you know, we often say we want to try and strive for a work-life balance. I don't think that it's about balancing work and life, because you are you're a person foremost, and we can't help but bring our jobs home with us, just like we can't help but bring our personal lives to the work that we do. And sometimes this is really good that we do that. And when it starts to impact our dream state, we know that we're heading towards our defenses are going up, and we're leading towards burnout. Thank you for sharing those responses. I appreciate it. Now, let's see here, discussion. If you could also name some words or phrases or actions that indicate to you someone is experiencing burnout or putting up their defenses. Some of the previous poll was about what you may be doing. Do you see a lot of those same actions happening in your workplace? I believe it's star 2 to unmute your line. Well, sometimes those individual responses can also be a group response. So let me share some of those additional signs of burnout. I'm not a huge fan of the term burnout. I like to refer to it more as these are just our natural defenses. And so when we are in that state, we often feel like we're like this gentleman, buried in paperwork and EHR records, right? We start to feel really disconnected and isolated from others, isolated from the patients that we are working with. We aren't able to connect with them on that deep, meaningful level like we would like to. We start to create an us versus them mentality, and where we depersonalize others. We start to judge them based on whatever characteristics that we have experienced in the past that told us that we needed to judge them. We start to show, when we do that, we show disrespect for ourselves and us. When we are operating in that mode, we start to really feel fatigued. Our brains don't have pain receptors in them to indicate when they are starting to feel fatigue and exhaustion to let us know it's time to take a break. Therefore, one strategy that I recommend is if you set your alarm every 2 hours and you take a break for at least 2 minutes. During those 2 minutes, you focus on gratitude, compassion, and novelty. Your energy levels are going to skyrocket. But fatigue, and that is really one of those strong signs of defenses coming up. We also like to say we're very busy. When people say, oh, how are you doing? Oh, I'm busy. It's that busyness that can also be an indicator. Our postures also indicate our stress levels. When you're very stressed, individuals have a tendency to, because we are bipedal creatures, our shoulders start to raise up to our earlobes. We start to hunch over, and our posture becomes either very small and diminutive, or it becomes large and expansive and overbearing in a room. So it's trying to find that right balance between having positive posture, a jaw that's relaxed. And when we're feeling all of these senses of stress, we start to have health issues. We start to become sarcastic, or as others may say, we start to become a little bit more hilarious. But all of these signs can contribute towards our defenses coming up within our organization. And when we're in that place, we start to experience a lot of these bullet points here. One of the most common things that I see is that third bullet point, lack of mid-level engagement in strategic planning and staff engagement in goal setting. That tells me that there is a value misalignment that's happening there. I also see a lot of organizations where there's a lack of intentionality in setting organizational culture. The leaders will say, we have so much to prioritize, we have so much work to do, but they don't stop to make the time to think, if I do this action, how am I going to impact the culture of the organization? In turn, when you're impacting that organization in a negative way, that can repel employees, that can repel customers away. But when you're working in a place of resiliency, this can attract employees, it can retain employees, and when they are healthier and happier, they're more likely to stick around and people want to be around them. So I'd like to hear one example that contributes towards your individual and organizational defenses or burnout. And just think about one example within your organization that is contributing towards this. I would like you to catalog that example that you have into one of these three root causes of stress. Either lack of control. Lack of control is, it could be something related to a policy issue. Lack of purpose or meaning could be contributed towards a situation that is misaligned with the work that you really want to be doing. You don't see any purpose to doing a specific task, for instance. Or the third, it could be there's too much to do and too little time. Is there any brave individual who is willing to share an example of an individual or organizational defense and what the root cause may be.
I can see that we have Michelle typing in the chat box here.
Great, thank you, Michelle. Yes, so much work to do and a small step. So it's then looking at the demand-resource imbalance and how can you prioritize. I often see a lot of conflict happening when there is priorities that conflict with one another and priorities that have values that have not been prioritized. And also a partner organization that is a challenge to work with, which is out of your control, or so much work and a bit of staff turnover. Thank you. Thank you for sharing this information. These are not uncommon at all. I see a lot of these same things, particularly coming from networks, because there is a lot of change, a lot of transition that's happening right now. And so with those examples that you have in mind, I'd like you to answer the next question. Is this problem solvable? Yes. Then you can tell, will it matter? Will this situation matter in 2 hours, in 2 weeks, 2 years? Really start to prioritize how can you reframe and prioritize that stressor. And if you can't, can that matter be reframed? So if you can change the way you view the world, then you can change the world. Sorry, that slide doesn't come out very well. So some of those, when you can change your view of the world, some of those common thought distortions that we have, we start to go into any one of these bullet points here. I know that when I'm in a state of constant stress, I'm prone to more perfectionism, and I'm prone to magnification. For instance, I'll give you an example. When I was in college, I would put so much weight on getting a perfect grade on a test. And here's how my logic, quote logic, would go. If I don't get an A on this quiz, then I'm not going to get an A on my overall, and then I'm not going to graduate with honors, and then I'm not going to get into the grad school that I want, and I'm not going to get the job that I want. And so I went from the state of perfectionism to magnification, and meanwhile, all of this went all spinning out of control. And of course, none of this was actually really happening. It was all within my head. I see that there is a comment from Micheline. It's hard to increase staff because we are grant-based, and it's difficult to staff up if we don't know if we can fund the position going forward. Suggestions are welcome. Thank you. That might be a situation of, can you reframe some of the duties? Can you look at finding partnerships? That might be an area where we should probably talk a little bit more in person, so I can find out more details about your situation, and then I can either help you reframe or problem solve. But thank you for your contributions there. I appreciate that comment. So as we're looking at when we're in that common thought distortion pattern, I like to say, let's try to bathe in reframing. And so asking yourself, what's the best thing about this situation? So what's the best thing about increasing staff because you're grant-based? How does that make you feel? What are you most thankful about in this situation? So in Michelle's situation, we can be thankful that the work, there's funding available for the grants. How can we make positive things like this occur more often as relates to this situation? This type of conversation, this framework, is really helpful in going through when you are having that common thought distortion. Go through this phase in reframing and evaluate the situation that you had identified that was stressful and give that a shot. Because when we aren't focusing on that, when we don't reframe, up to 90% of chronic diseases are caused by stress. And that stress is making us sick. In fact, 1 in 2 Americans have established a chronic disease. 1 in 4, multiple chronic disease. And we're seeing that this is prevalent throughout prescriptions and physician visits. 7 out of 10 deaths are attributed to chronic diseases. And all of these statistics are because stress is the root cause. So this tells me this is preventable. Stress is preventable if we focus on our resiliency and we focus on establishing and operationalizing a plan to integrate our resiliency so we can live healthier, happier lives. And when we are in the workplace, we spend 40 plus hours a week. And your workplace has a greater impact on your health than your family doctor. So it's a lot to expect that this can happen within your 15-minute primary care provider appointment annually. We need to be able to work together with organizations, with communities, and work with workplaces so we can address and support one another when we are feeling our most stressed. So we can continue to do the work that we're doing. And this is really creating some expenses for us. In fact, there is an article put out by JAMA, Journal of American Medical Association, that when nurses in the ICU were sleep deprived, they saw that errors increased 464%. 464%. That is an outrageous number from statistics for being stressed and being sleep deprived. We see that this is costing U.S. employers $500 billion annually. But what we know is that the best indicator of job satisfaction is whether people have positive physical and mental health. And the reason why people are leaving is because there's poor morale. There's poor leadership happening. And when you have that misalignment of values and it's a really stressful work, and we need to be focusing on our resiliency. And our physicians, our providers, are not immune to this. In fact, physicians die at a rate 2 times higher than that of the general population by suicide, which is the highest occupation of suicide. We've seen these statistics before, but they're quite alarming. Nurses are in the same situation. 24% of ICU nurses tested positive for post-traumatic stress. So we need to be caring for our carers, heal our healers. And why should we focus on resiliency in healthcare? What we're seeing is that there are examples out there. I'm in the process of collecting some of this data right now, and I hope to be reporting on Integrative Resources' own findings. In about 3 months, we'll have some of this data available. In the meantime, here's some examples where we're seeing that when you integrate resiliency in healthcare, it really is effective. Over at Mass General, they focus on creating, providing a resiliency education. So the 3RP is relaxation and resiliency response program. When they provided that with the cancer survivors, they saw a 43% reduction in clinical encounters with a tremendous amount of hospital savings as a result of this. And this is just for the fact of educating about relaxation and resiliency. These are tremendous savings that we're seeing. There's also an example here in Minnesota where a health system adopted a resiliency training for their staff, and they saw the quality of life scores increase dramatically as a result of this program. Another lesson here, this is just a wonderful reinforcer that when you have not just the C-suite team and the board or just the physicians, you need to really engage all levels of individuals who are within the organization. When you do that, they actively participate in the development and strengthening of their own personal resilience, we see a reduction in workplace stressors. We see restructuring and excessive workloads go down, and thus care and quality is improved overall. So really engaging everybody within the organization. So I have a resiliency toolbox to help get us prepared on how do you go about this. So the first box here is to relax and get out of that survival mode. I have a whole curriculum focused specifically on, it's called Heal Thyself, to get yourself out of that survival mode, that default mode where we're always focusing on multitasking, we're always looking for what's wrong in the situation. When we stop and we're able to relax and get out of that fight or flight response, we can start to make better decisions. We can start to retrain our brains. And the way that we can best do that, I'll give you just some real quick strategies. One I mentioned earlier, where you set an alarm for every 2 hours, you take a break for 2 minutes. And during that 2 minutes, you focus on gratitude. And when you're focusing on gratitude, you want to be able to visualize someone, some creature that you're appreciative for at least 2 minutes. Or you want to show compassion. Showing compassion is getting outside of yourself, not feeling the pain that you're experiencing, the adversities that you're experiencing, but seeing the pain and the suffering of others and showing them some kindness, compassion, doing something nice for somebody. Or it's creating novelty. Novelty is thinking like a 4-year-old and seeing the world with curious eyes. Look at the world through an artist's eyes, perhaps. Learn something new. Do this for 2 minutes. When you do this, you will start to rewire your brain. You'll move your stressful events from your amygdala, your fight or flight response, into your prefrontal cortex. where your decision-making and problem-solving and creativity occurs. We start there in this toolbox. We next move to identifying what are our values. Reflect on your personal values. We often don't make the time to do this, where we certainly know when our values are not being met, but do we always know when they are? So really reflecting on what are our values, and then being intentional to define how can we filter the actions that we are doing into how can we operationalize it? That's maybe a quicker way to say that. How can we operationalize our values from the mission that we are working on to the everyday tasks at hand? And can you connect those actions? Can you connect actions to those values? And how do you build? How do you build alignment with yourself and with your team, with your colleagues, and with your community that's also aligned in those values? When we do that, we are creating that culture of health and happiness. And what I see is that we all tend to have, we take a look at this lower triangle here, we all have the knowledge about resiliency, we all have the skill, and frankly, we all have the time and the motivation, but there is something lacking that we are not doing this. So really, or prioritizing that. So looking at how can we prioritize those values and how can we navigate that appropriately. And I think when we are working within our teams, we're trying to toggle between the state of heal thy team, where we have that sense of a lack of control. We're suffering with a lot of the demand resource imbalance. And in turn, that leads us to fatigue, exhaustion, and self-medication or vices. When I'm stressed, I have a tendency to lead towards one of the best inventions in the world, chocolate cake. It may be another vice for somebody else, but it's really looking at how can we find that right balance, because this is never going to be stable. We're always going to have stressors in our work environment, in our world, and so how can we find that right balance where we have a healthy team, where our team is able to reframe effectively, and we really focus on what matters. And consequently, when we do that, we are happy, we're relaxed, we show a lot more self-compassion, versus self-medication. And so really taking a look at how can you navigate this situation, this work environment appropriately. So I've created a framework that's based on a lot of peer-reviewed evidence-based research in psychology, nursing, medicine, to identify and create a plan focused on the 6 Ps. Now these 6 Ps include people. What is the strength of the social connectedness? An example of where we see something like this go wrong is when we value our employees' time with family, yet we expect email responses and work due on evenings and weekends. So how is that impacting the strength of our social connectedness or alignment of our values? So really looking at people, looking at purpose. How do you align your values with the work that you are doing? If you're providing compassionate care, what does that mean? Define what compassionate care means, and how are you operationalizing compassionate care? What is the process that you're utilizing? Be really specific in identifying that process that you will use and how you will operationalize your values on a day-to-day basis. And you may already, and I'm suspecting each one of you on this call is already doing a lot of this work already. It just hasn't been organized or cataloged into this manner. And so putting it into this type of framework that's very systemic and will help you in creating some of those measures and that will define your success in integrating resiliency practices. It's also looking at policy and how can you cascade your values into your culture? How can you hardwire that and create policies that are best aligned? For instance, can you create a policy that values mental well-being of your employees, that focuses on both that sick time can be used not only for physical ailments, but for mental distress as well. Of course, every framework needs to be focusing on profit and measuring those cost savings associated with such. And finally, looking at what is the impact of this on our environment. Are we offering dignity to the senses, and are we showing environmental stewardship? As healthcare networks, we need to be considering how extreme weather is impacting our stress level, how extreme weather is impacting our health, our chronic diseases. And so if we create that alignment and really focus on mitigating those stressful events, it is beneficial in our overall health. It's beneficial in the retention of our employees. It creates, we become a desirable place to work. It creates an environment that people want to be around. And so as you take a look at developing a program for yourself on how are you going to integrate resiliency, here's a really nice checklist of sorts to help you get thinking about that training program. Really take a look at what kind of stress do you want to mitigate? What is the top issue? Are you looking at generalized stress, stress in general, or are you looking at focusing on trauma-induced stress? Is the resilience development the end goal, or is this just a means to another goal? Really take a look. This is a helpful chart, and having an effective conversation about where do you go in developing a culture that embraces health and happiness of your employees and of yourself and of your customers and your hospitals and networks. Feel free to give me a call and we can talk through this. I'm happy to be of assistance on working with you to integrate resiliency practices within your team that is engaging and can deliver results. I've got my email address there. We've got a lot of success examples that we're gathering right now, utilizing this framework that I'm happy to share with you on another call or dive in deeper. So as we look at summarizing this information, really focusing on, here are my top tips. When relax, really look at identifying the early signs of burnout, those defenses that we have, so you can more effectively problem solve. Focus your attention and catalog the root cause of stress. Is this demand-resource imbalance, lack of purpose, lack of meaning? Be intentional. Bathe in reframing. And foremost, connect those actions to values. Be intentional in operationalizing the compassionate life that you lead. We all know this information. It's just a matter of aligning this in a way that really exemplifies the values of your work, the values of you personally, so you can best meet your mission and you can achieve your vision. What is one strategy that would help your workplace be healthier or happier based on the information that you heard today? Yes. Making some time to do a retreat and perhaps celebrate the excellent work that you are doing. Excellent. Make sure expectations are clearly communicated to reduce confusion and stress. That's huge. When you can do that, you really mitigate those future stressful situations and adversities. Oh, I like this. You started a wall of gratitude, and everyone writes one thing they're thankful for each day. That's really beautiful. These are some great suggestions and really helpful tips. And see, we know how to do this. It's just a matter of being intentional about this work. Regina Smith says recognition of team members. That's another really big one. Take a look at these, the wisdom of your fellow network team members here, and jot them down for yourself, or perhaps Kiona can share them with you after this call, so you can look at some of these strategies that are working, that's helping to mitigate those stress levels, so we can all be healthier and happier and work on our missions most effectively. With that, I thank you for your time, and please feel free to reach out to me. My contact information is here. I welcome any questions, comments, good jokes.
Thank you for that great information, Cami. At this time, we'd like to take a few minutes or a few moments here to see if anybody has any questions or comments that they'd like to share right away. You can either use the chat box in the middle there, or you can press *2 to unmute yourself.
Well, I'm available for additional inquiries if folks would like to talk offline. In the meantime, I wish you all great success and continued happiness in the work that you're doing, and I hope you have a great day.
Thank you so much, Cami. And thank you, everybody, for your participation in the polls today. We're going to transition here to our last layout, where we have a few poll questions, and we would really appreciate if you could take a few moments to answer these for us. I'd just like to do a quick few TA reminders as well. So in August here, I can't believe summer is almost over. August, we have the community-based care coordination cohort call that's going to be on August 8th. I'd really like to share, and I will share the link here in the chat box, so you guys can go to this one if you would wish. The Sustainability Action Planning, or I'm sorry, the Collaboration for Impact workshop that we are hosting here in Duluth. A few communications have gone out about that, but there is